Thank you very much for giving me the opportunity to give you really an early heads up on a new model of working that we have been piloting within our Trust Domiciliary Care Service. Domiciliary care, those of you who aren't familiar with the term, it has evolved from our old home help type scheme and has become much more complex as our family and friends and neighbours are living much more independently in community. They have much more complex needs, and the whole change in picture of domiciliary care has evolved with that change in needs. I'm going to try to describe to you today what currently our domiciliary care service looks like, what our new model of working looks like, and how we're really challenged with focusing more on outcomes that we're trying to achieve rather than just keeping on the treadmill. And within that, I'm going to share with you an experience that we're currently working through in the Armagh and Gannon locality area, where we've been piloting this new way of working in our Trust Home Care Service. And I'm going to share with you within that a couple of personal experiences which I think demonstrate for you maybe a more traditional domiciliary care model and a second experience that is more about perhaps a vision for how it can be into the future, and a lot about getting the experience right for our service users and our staff. If we get that mix right, it is so much more potent there in the relationship. As I say, domiciliary care is one of our, in many ways, most valued service and sometimes most underrated because we don't actually value the importance. If home is right, a lot of things go right in our lives. If people in our family and friends need care, if we can get that right, it really does help. Okay, so we knew there was lots of issues with the current model that we have in domiciliary care, and some of those around, particularly around the issue of time for task. We currently work on a model where your care needs are worked out into what is it that needs to take place when the domiciliary care worker visits you, and that's worked up into an approximate time. And so the rotas and the whole emphasis that's on the delivery of that care is based around a factor of time. That doesn't allow us the ability to be responsive. That doesn't allow us, if somebody needs a bit extra, to have some flexibility. And we were aware that we needed to have a greater focus on flexibility. We also needed more timely review, because if we can't review clients on a quick, timely basis, we can have a gap between their changing care needs and us being able to respond to that. We had moved more recently within Southern Trust to offering all our new packages to our independent sector. We have got 23 providers out there who provide domiciliary care to us, for our clients, with our clients, and we also have 1,100 staff within our Trust domiciliary care that actually deliver care through us. So we had all new packages that were becoming available, being offered to the independent sector, and that was part of our journey of trying to regain our financial balance and trying to get that shift of resource into the right places so that we could deliver the services within the resources we had available. We had been offered, through Transforming Your Care and through the focus on trying to work differently within delivering services and maintaining people and supporting people within their home environment, we had been offered some support externally to think, what could it look like into the future? What are some of the models of best practice internationally, nationally, happening elsewhere within Northern Ireland and the Republic of Ireland? How did we have some evidence of what that would look like? And we got a good piece of work done that actually gave us a firm evidence base to come from. And we also had our colleagues within the planning department supporting that, then to follow up how we could actually do something about addressing that. We had quite a focus on the finance, and I make no apology for saying that, because we had to make sure that we were delivering our services within the resources available. And this was our opportunity to take the focus away from the financial bit, because we had achieved what we'd set out to achieve from a good financial management perspective, but we wanted to make sure we had an equal focus on the quality of the service we delivered, and that was critical in this model. We also have a need to procure our domiciliary services into the future, and therefore we wanted to know what are we going to be buying from our private and independent sector partners. So we needed to know what does Trust Home Care need to do so that we could understand better what we needed to procure into the future. So really what we needed to do was grasp our opportunity and actually test some of the examples that we had been given. I'm going to share Laura's story with you here first. And Laura has a dual role here because she has been a previous care worker, and she's now sharing her experience as somebody who had an episode in her life where she ended up needing care. And I think Laura's story here demonstrates perhaps that more traditional model of domiciliary care where the whole social inclusion and the whole practical support that's needed is valued. Laura.
I'm Laura Davison. I'm a domiciliary care worker. Back in February, I was very silly in my home. I climbed up on a chair to fix a light, which I probably couldn't have fixed anyway, and the cushion went round, and down I went on a Sunday night, and I smashed my heel. So I just immediately went from a care to being cared. So I live on my own. So I went into Craigavon. I was 2 days in Craigavon, 2 days and 2 nights, and they didn't have to operate. It was a matter of no weight bearing for 3 months. And they wouldn't let me come home unless I had care. They said, you can just turn around and take your care now, instead of giving it,
Right.
So I came in home and I got this great team of enabled care. And I had the girls coming in. I had to move my bed down to the room, and I had the girls coming in 4 times a day, doing what I was doing myself. Personal care, warmed my dinner, done my tea, changed me for bed at night. I went down on my own time. I was in a Zimmer frame, I couldn't manage the crutches. Oh, horrible time, the worst time in my life. With the personal care, I couldn't wash my hair, you see. I couldn't get up the stairs there, so I had to go to the wee back porch there. So I kept my care up until I was 6 weeks, and then that was me off then. Well, I had to leave a key out for them, right? I had that girl coming in the morning. That was a great help to me. Somebody coming in. I missed all this getting up, going out, meeting the people. I missed all that company. So the girls coming in on was company. Number one. Two, I got up and I got my breakfast before they came in. And then I walked to there and they gave me, I did as much as I could. I didn't want to forget that. They had to wash my hair, done things like that, and chatted and talked to you. And then they went out, and then they come in, dinner time and tea time, I admit it, later on. They were a brilliant team, and they were a pleasure to work with, and without them I could not have coped.
Okay. And Laura is particularly referencing there the support of the reablement team who helped her in that journey of recovery. So what did we do? We sat down and we tried to work out what do we actually need. We sat down and we worked out what do we actually need to make this new model work. And one of the things we thought particularly was an occupational therapist input. We wanted to make sure that the functional assessments that need to take place to make the whole activities of daily living that we all experience work well, that we needed occupational therapy input within the team. We needed to make sure our staff were trained up to be able to work in this new independence model that we had a vision for, and we needed to know that our supervisors who supervise the clients and the staff out on the ground delivering the care, we needed to know that they were freed up from their office duties to be able to actually be out more on the ground. And we needed to make sure, therefore, that they were contactable and we had equipment to back them up to make sure that we could communicate throughout that. We needed to have a project management structure that set the whole methodology for how we were going to approach this pilot, but also made sure we had representation from all the different teams right across so that we were informing it as we went with the range of different staff teams. We needed to have the baseline picture, and we needed to say what are we trying to do and how are we going to prove that, what do we need to measure and what criteria do we need to put in to keep us right throughout this. And one of the critical bits in this was our communications plan. Every client got a home visit. They were carefully explained what we were trying to do, and they consented to take part in that. But critically, right across all our key workers, which are in mental health, disability, right across all of our programmes of care, not just older people's, we talked to them, we communicated to their GPs and to our elected reps out there, our MLAs, and that was important to us, because quite often if somebody sees a loss, there's a change to my programme, that turns into potentially I'm not happy and even a complaint, and we needed to make sure, work with us, allow us to work with this. If you don't want us to work with this, fine, but allow us to work like this, because we believe it will actually have benefit for you. Okay, we wanted to have a focus on a caseload rather than a time for tasks. So we wanted to know you went out at 9 o'clock in the morning and you finished at 1 o'clock, and between those 4 hours you might have 8 or 10 visits to do, but you weren't rushing in saying, if 20 minutes here and if 15 minutes there and if 30 minutes here and somebody's off their feet, oh dear, I'm stuck for time now because I'm really working to such a tight threshold. So we needed to make sure, as we do in health visiting and district nursing and social work and a lot of our professional groups, we carry a caseload and we go out in the morning, and you might go into a house and think, I'll be in this house for half an hour, it might take longer, but you have that flexibility to work within that, and we wanted to get more into that model. We needed to make sure that people were trained appropriately, and our reablement team particularly were a brilliant resource for us to get us this focus on independence. We set a boundary of 70% of this domiciliary care supervisor time to be out on the ground, so that she was the oil in the engine making this work rather than being tied up with administrative duties. And that, in fairness to the whole team, needed the back office support in terms of our administration, our business management, or our managers. We needed all of that to fall in and make that happen, and our other domiciliary supervisors taking some of that load. The focus was, we will do it with you, not for you, and that's a big thing in this independence model. The new bit for us was goal plans. We had no focus on outcomes. What are we trying to achieve? What are the goals you want as a person, and how can we work with you to achieve that? And that is a new thing, because previously our care plans were really professional plans. These are the range of tasks we need done, and it was very much not a person-centred model. So the goal plans, particularly driven through our occupational therapist resource, was a big development. The other thing I think was critical was hearing the voice of our dom care worker. The person who knows the client and the family best is the person who's in the house every day, 3 or 4 times a day, perhaps delivering the care. So we had meetings on a weekly basis for the dom care workers to tell us what it's like, and allow us to flex and to change in response to what the real life picture is in that home. And that involved obviously the input from the family and the clients as well. They feel particularly valued for being involved in that. That allowed us to tailor the packages, and it allowed us to tailor the packages that needed to increase where there was additional need or the packages weren't appropriate, and it allowed us to say where is there greater flexibility so that we can respond to all of our clients rather than being very fixed on our current times. That allowed us to create capacity, and therefore we were able to bring in new packages and new clients who needed care into our loop much faster, because we actually were freeing up some capacity to enable us to do that. And we rolled it right across 4 patch areas across Armagh and Dungannon. So what have we found out to date? We know we have a much more responsive, timely assessment. We have resource on the ground through the supervisors, through the OT and through the key workers to actually respond on the day. If somebody is off their feet and needs a bit of time that day and it's just a one-off, we can make that happen. And if somebody needs a more permanent change to their care package, we can make that happen as well. We have staff here delighted to be working in this model at all the levels within domiciliary care, and we have clients who are giving us extremely positive feedback, and we've had no complaints at all about our service and our changes within that. We have demonstrated greater efficiency in our packages in terms of money and in terms of capacity, and I'll demonstrate that for you in a minute. We definitely have shown that there are better outcomes for the individuals, which is the very reason why we're there, and a greater focus on independence, which again we can demonstrate. And we have much better relationships right across Trust Home Care and our intermediate care teams, our reablement teams, our ICTs, all of our different teams out there. We have much better working relationships right across that interface. what we have demonstrated to date, we have increased packages to the tune of about 47 hours. So people who needed their packages increased across that 130 clients, we have increased by 47 hours for that 130 clients. Okay? So we have shown some of those clients needed more time, more space to have their care needs met, and we have increased that. But we have decreased the actual timing because we've been able to sensitively tailor by 190 hours. So in actual fact, 4 times we were able to tailor downwards compared to every one that we were taking up. And that's been critical because that meant, number one, not just was that more efficient in terms of the cost, but in terms of the quality factor, it was much more sensitive to the person's needs. That has allowed us to take in 32 new clients who we hadn't the space to take in because we've created capacity within those caseloads. So we're taking new clients in, we've increased in line with need, and we've decreased in line with need. So the packages are very much sensitively tailored. And that's been critical in terms of us showing. And we also have indicators that show the independence and the quality and the feedback from our staff teams and from our clients that has enabled us to do that. So what next? We need to work out better the roles. What's the supervisor role? What's the OT role? What's the key worker role? And we need to get better at that. We have to be able to sustain this model, and it can't cost more. So we have to be able to think, how do we make that happen by a different skill mix within our resources? And that's presenting some challenges, but that will need us to look forward. What does that structure look like? How do we shape that? And how do we consult on that? We have had our staff side colleagues on board with us throughout this, so they're very much on board with this model of working and very happy with how it has worked out to date. We have a greater focus now on independence training, and the old NVQ, which is now QCF, we're now rolling for the next 18-month independence training for all our domiciliary care workers so that we can perpetuate this model. And we're also planning to move, once the pilot ends now in November, right across the whole of Armagh and Gannon, not just the 4 patch areas within it, so that we can say in a third of our trust area, can we make this work before we have the potential to scale up trust-wide? And I'm going to finish by sharing with you now Rosemary's story, which I think highlights brilliantly the patient-client experience, and the experience not just for her mother but for her as a carer, and this whole focus on independence and working with and partnership. And really, if we get our approach and our communication and our behaviours right, it can be such a lovely experience for the clients that we work with.
My name is Rosemary Paisley. I am a service user, and we had the service of the reablement team based in Dungannon. You know, the service was fantastic, but when Mummy came out of hospital, it was just a shock of everything that had happened. Over a period of 3 months, she had been in 5 times, and each time she was getting progressively worse. And it was just being hit from a perfectly healthy lady coming out to somebody who needed everything done for her. And it really was. It was such a shock. But them girls come in, and it made no difference if I had got 1 hour's sleep or if I got 5 hours sleep. They come in and they were like a breath of fresh air. They always come in. Everybody brought something different, but all of them were kind. Everybody showed Mummy great respect, which was really, really important to me. So it was, you know, I could feel safe that I could come up here for 5 minutes. I knew she was happy with them. And they came in, they were always bubbly. No matter if she was down, if she'd had 1 hour's sleep, or, you know, if she'd had a very restless night, she always had a smile on her face when they left. And that to me said everything. And she really looked forward to them coming in. So she did. They encouraged her, because some days she really wasn't in the form. But they encouraged her as much as they possibly could. And she felt good that she had achieved maybe a wee bit more. What she couldn't do, they assisted her. And it was just, they were so kind. I couldn't tell you. You know, they cheered me up. They were there as much to support me as they were Mummy. And that was really important, because it was like being hit with a steam train. I'm an only child, so there was no backup. They were my support. They pointed me in the direction if there was anything that they thought that Mummy needed. But all in all, I couldn't thank them enough. Every single one of them brought something different. And they were, superb. They kept reassuring me that, things would get better. And you need to hear that. So you do. And they're right. We've got into a pattern, and we're not muddling along anymore. We can now work out what the next stage is. And, I'm not saying that Mummy's going to get any better than what she is, but everybody's finding where we're supposed to be. Whereas at the start, days and nights were all mixed up. It was a bit like having a newborn baby. You didn't know days from nights. But no, they were brilliant. They kept saying, no, we'll get into a routine, and, everything will start to progress. And they were right. They've been doing it longer. They've saw other families that have been in the same turmoil. They kept reassuring me, and they reassured Mummy. And that was great to hear, because they were the professionals. And they knew what they were doing. They came in, and they always asked Mummy's permission. They always gave her their names. It got to the point she didn't care what their name was. She knew them. She knew their faces. She knew she had pet names for all of them. Not always necessarily their own name, but she had pet names for them. They were all good. But they all brought something different. So they did. And Mother's quite inquisitive, and she got to know wee bits about them. And that their children were getting married, moving house, starting school, and she wanted to hear that, because she was a very outward person and would have been out and about all the time. Being at home was a big change to her. So they brought little bits, they weren't given their life history or anything, but it was just something new to her. And, they had a joke with her, and it was great, but they showed her unbelievable respect. And her, at no point was her dignity taken away, and that was so important. They treated my mother like it was their own mother, and every one of them did that. And that was, nobody can tell you how good that felt to me. And if they'd have been working with Mummy, I felt confident that I could have went to the shop, which is half a mile away. And there was many, many days that was my only time out through the door. At the start, there was no difference between night and days. Apart from them 10 or 15 minutes in the morning, because when they would have been washing and dressing her, that would have been the longest time they would have been there. And that was the only time that I would have had time to have nipped to the shop, or even just to have walked to the end of the road and back in again. Because I knew for the rest of the day I wasn't going to get out, unless a relative. But even with them, even though a lot of them are really, really good, I wasn't at the stage where I felt confident that I could leave them, because Mummy's condition could change like that. She could have taken another stroke. Some of them would have known exactly what to do. Some of them may not. And she wasn't happy if I wasn't there. Whereas with the girls, it was, go on ahead. She was safe. She knew she was safe. They really, really encouraged her to get her independence back. And, at the start we thought that was going to be possible, that she was going to regain everything. She did take, she had been in hospital in a few more times. But they encouraged her every time. And, when she'd come home, she would be exhausted. But with every one of them, you win another holiday, Barbara. They didn't say, oh, this is terrible. They kept everything upbeat. At no point did they let her go, oh, this isn't good, and then she was going, because she would have went down, but she would have joked with them and said, well, I'm not going on any more holidays this year. I know it was their job, and I know they got paid. No money can give you the peace of mind that they gave me. No money. And the emotional support. Even if it was just somebody putting their hand on my shoulder and saying, go you on out there for a minute. Because there was many times you just wanted to sit down and cry. And I would never do that in front of Mummy. But just knowing that you could go outside for a few minutes. Thankfully, it's getting easier. there's less tears. There still is a few, but the girls were superb, and whoever's getting them next, they're very, very